Good evening to you all, the participants who are from India, and very good morning, the participants from the other side. So I'd like to welcome you all for this international webinar series organized from the Institute R&D Cell, Department of Mathematics, and Department of Chemistry, BLDES College of Engineering and Technology, Vijayapur, in association with a committee for promotion of science, humanities, and research, BLDE Association, Vijayapur. So as a part of this international webinar series, today we are going to have an invited talk on the mathematical modeling of epidemics, COVID-19 especially, from one of the resource person, Dr. Americo Cunha from Rio de Janeiro University, Brazil. So with this, I would like to request Dr. Pradeep Malji to give a brief introduction to this particular webinar series. Over to you, Malji.
Welcome all. I welcome all of you to this webinar series. This is first of its this webinar series, and we are glad to have Americo, and we are thankful to Americo for accepting our invitation in a limited time of period. We sort of having an interaction with different researchers, interdisciplinary researchers. In that regard, R&D Cell along with CPSHR, we thought of having international webinar series. So part of that is this is the first one that series, and Dr. Americo from Brazil has accepted our invitation. So we'll be hearing more about Dr. Americo from Dr. Sankar. So I request Dr. Sankar to introduce our guest speaker of today to all of us.
Good evening to everyone. Thank you all for joining today's international webinar series. It is a great pleasure for me to introduce the resource person, Dr. Americo Barbosa D. Chunas Jr. For the webinar talk on mathematical modeling of epidemics caused by infectious disease. This is a subject in which we should all be deeply interested because of its significance in the present situation. Our speaker is an associate professor at Department of Mathematics at Rio de Janeiro State University, and is also an associate editor of the Journal of Vibration Engineering and Technology, edited by Springer Nature, and the secretary of Nonlinear and Chaotic Phenomena Committee at Brazilian Society of Mechanical Science and Engineering. He holds a bachelor, master's, and doctoral degree in mechanical engineering from PUC Rio, where he's also earned a bachelor degree in applied mathematics. He also holds a second degree from the University of Paris based in France. His research involves several fronts in the area of nonlinear dynamics, with a recent interest in modeling and simulating epidemic phenomena. Dear participants, please join me in welcoming Dr. Americo Jr. for today's invited talk. Now, our research person will carry over the session.
Dear participants, because of some technical issues, we are unable to give it a live streaming on YouTube. Once this meeting is over, so anyhow, we will be having a recorded version of this, and that will be shared on the YouTube. We apologize for that because of some technical issues, we are unable to do it a live stream on the YouTube. Okay. Now I request Dr. Americo to carry on with the session.
Thank you, Dr. Ramesh. Thank you, everybody, for this nice introduction, and especially thank you for the invitation. It's a great pleasure to be here and have the opportunity to present one of the line of research we have been following in our research group, which is related to the modeling of epidemic phenomena. I'm sharing the screen now. Can you see the screen?
Yes, we can see it. We can see it.
Okay. So what I will present today is a compendium of the basics in epidemic modeling, mathematical modeling of epidemics. Okay, I believe a significant part of this audience is interested in the topic, but perhaps don't have any training in biological science, and it's very likely myself in this sense, because I became interested in this difficult part to understand the results you obtained with the mathematical models, interpret correctly, okay? And this was a extremely useful lesson that this kind of problem is multidisciplinary and you need to work in cooperation with people of other sciences to do a proper work, okay? I will present today is split in two parts here. First, I will say useful concepts that you need to understand in order to avoid the misunderstood the results, and the second part is a compendium of mathematical tools that can be used in epidemics, okay? I will start with basic vocabulary of epidemiology and talk about some phenomena that is intrinsic to epidemics that needed to be considered in the modeling. And after that, I will start to introduce the possible mathematical approach that we can use here, okay? But to motivate this discussion, I will start asking the audience a question, okay? I'm presenting here some numbers related to two real case epidemics, okay? We have here in the left an epidemic caused by a disease A, which the case fatality rate was around 40%. That is, among the infected people, around 40% died. At least this was the cases that were registered. Maybe this number could be higher or lower, depending on the under notification, but perhaps higher. But this is the official number. And the transmission mechanism of this disease is body fluids, okay? It's caused by the contact of healthy people with the body fluids of an infected person. And the second case I bring to you, the disease B, has a case fatality rate of around 0.01%, okay? And the transmission mechanism is respiratory droplets. The question I wish to ask it to you is, after 1 year, which disease killed more people? Okay, these are two real cases, okay? These two outbreaks occurred. I wish you answer me, which one caused more deaths after a year, A or B? Mr. Chairman, as I can't see the chat, I kindly ask you to tell me the responses of the audience.
Case B.
B, okay. I will ask another question. If I ask this question 3 years ago, Everybody will answer B or A. Perhaps A. But now, as we are living a pandemic and people realize the problem with respiratory disease. Well, the first case is Ebola. The last big outbreak of Ebola in Western Africa started in 2013 and up to 2016, infected around between 30 up to 15,000 people and caused the deaths of around 11,000 people. The second case is the swine flu, H1N1, which occurred between 2009 and 2010. The number of infected people is estimated between 700 million up to 1,040 million, okay? The order of magnitude of the number of infected here is tremendously different, okay? And despite the case fatality rate is small, as the volume of infections is tremendous large, you have a lot of deaths. The estimated number of deaths is something between 150,000 up to 575,000, okay? So what this example show us is infectivity may be much more dangerously than virulence. And in this sense, flu-like illness are a major threat to the public health, okay? And mathematical tools, mathematical models can be very powerful and useful to orient the public health authorities to deal with situations like both I'm showing here, and especially the second case, which is much more dangerous, okay? So starting with the concept in epidemiology I wish to introduce to you, I'm showing here a typical curve of an epidemic outbreak, okay? Not all epidemic outbreak follows a trajectory like this, but most of them follow this kind of trajectory. And even the more complex outbreaks, which have multiple waves, each wave is more or less like this curve here, which is composed of three phases. Initial exponential growth, where the epidemics spread very fast, okay? And you have a kind of exponential expansion here. Then the expansion slow down, and you have a transition phase up to a point where the number of cases start to decrease, and then you have a long exhaustion phase, okay? Typically, this is the behavior of epidemic outbreak, okay? So if we wanted to model outbreaks, we needed to be able to reproduce this behavior with equations. But we can't be very blinded and think, oh, it's just to fit a curve to the points representing this outbreak, okay? There are some intrinsic phenomena that must be considered, especially when we are analyzing the results of the mathematical model predictions in this context. And the first effect that can't be neglected in the interpretation of the analysis is the multiple scale nature of a pandemic or a large epidemic, okay? I'm showing here in this map the numbers of COVID-19 in the world, okay? This graph is from May 1st, okay? It is colored according to the daily number of confirmed cases per 1 million people, okay? You can see here that Brazil is was at this period one of the most critical countries in the world, okay? It is colored according to the highest value in this scale here. But if we go there and zoom in, we see that the situation inside Brazil is not homogeneous. It's extremely heterogeneous, okay? This is the same map colored according to respecting the geographic regions frontiers in Brazil. Okay, it's each state. Brazil is a federation of states, and each state here is colored according to the numbers of the epidemics. The same numbers I showed before, but now in a country level. And even more, Brazil has more than 5,000 cities. And if we color in the city level, you can see that the situation is extremely heterogeneous. If I go back and look here, it may pass the impression that the situation is catastrophic in all places in Brazil, which is a continent-size comparable country. And it's not like that. The situation is should be taken carefully every place, but you have cities that are worse than others. Even inside the state, there are some regions which the situation is less dangerous than in others. Okay, so when we interpret the results of the models, of the model predictions in this scenario of epidemics, we need to be careful, because if we fit the data in the country level, when we do this, we're doing some kind of average that can cause confusion. If I interpret the country level results for this place here, is definitely not equal to this region here. Okay, here the situation is much more seriously than this, and we could inform wrongly the population if you do this. So take care of the scales is extremely important. Okay, if we wanted to do quantitative predictions in this scenario, it's extremely important that we do this in the local scale, okay, in the city scale, and even in the big cities, maybe in a smaller scale. Okay, in a big scale like this, country, state levels, we can use to obtain some qualitative information more, but quantitative in this scenario make few sense. Okay, so I'm showing here a graph that's very common to see comparing countries. After you see this previous information here regarding the scale, the message I wanted to transmit to you is comparisons like this must be done very carefully, because most of the time they make no sense. Okay, I can't compare a country like Brazil that's extremely big with a small country like, let's say, with Chile, that it's much smaller, or Saudi Arabia, which is even much smaller than Chile. Okay, maybe makes sense compare Brazil and United States, which are big countries, and Brazil and China, Brazil and India, but definitely Brazil and Italy make no sense, China and Italy make no sense, India and Italy make no sense. Okay, so how the math enters in this game? So mathematical models here, I wish to think them as a machine, a predictive machine. Okay, what's a machine? A machine is a device which receives a certain material, process it in some way, and give you back a certain processed product. Okay, here in this schematic, you have metal entering this machine, being processed, and give you a final product. Okay. In terms of the mathematical model, the raw data which enters in the model is information about the epidemic phenomena. Okay. And the model processes this information in some way and return it to you a prediction. Okay. The final product is a prediction. But what are the engines, the internal engines of this machine which process the information to transform it into a prediction? The engines of this machine here are mathematical equations. Okay, this is the useful interpretation of a mathematical model in the context of epidemiology. Okay, but if we think a model as a machine, we need to be aware that a machine may produce bad quality products in some cases. Okay, what are the cases where the machine produces a bad product? If the machine is defective, okay, and in the context of the mathematical model, this is an analogy to use the inappropriate model to forecast some situation, okay? If you use a model that's not suitable for the situation, of course, your predictions will be poorly obtained, okay? And another scenario that's very critical in epidemics too is to use low quality material. If your machine is suitable and high and standard state of art, but you feed it with a poor quality material, the final product quality will be inferior than it could be, okay? And the low quality material here is poor data, okay? Unfortunately, in epidemics, most of the time, we can't avoid poor data. So we needed to be aware that our predictions can't be trusted with an extremely high level of confidence as we trust sometimes in mathematical model predictions in the context of physics, for instance, okay? So what you can see here is a file that Brazilian surveillance system uses to catalog information from a specific patient in COVID-19 pandemic, okay? You have a lot of fields to be filled, but I wish to highlight two fields here. In this file, you have a date related to the opening of the file. So this is the date where the patient looks for health attention in a hospital, and it's called notification date, okay? And a second date that must be filled here is an estimated date of the first symptoms with the disease. So the health system has hundreds of millions of these files open nowadays, okay? And it constructed the epidemic curves that you can see in the news with this information here. I'm showing here the epidemics, the number of new cases in Rio de Janeiro city, organized in two different ways, okay? The left curve was constructed taking the information from those files and agglutinating the data by first symptoms date. And the second curve was obtained agglutinating the data by notification date, okay? The day where the patient looks for attention in the hospital. You can see that depending on the way I organize the information, the shape of the curves are very different. Can you see? While here, up to April of this year, we had 3 or 4 well-pronounced waves. If we organize by first symptoms date, if you were organized by notification date, we have 1, 2, 3, 4, 5, 6, 7. We may see up to 7 waves here. Okay. This is a factor of confusion a lot in the modeling. Okay, especially during this pandemic, many people without previous training to deal with this kind of data started to do predictions with the best of intentions, but by their lack of knowledge about this data, they could do extremely wrong predictions here because they don't understand one thing. Why we have a lot of the oscillations here in this right one and we don't have a lot of oscillations here in this left one? The notification date, during the weekends, the number of people that look for attention in the hospitals decreased dramatically. And some health units are not open in the weekends. So the number of registrations in weekend decrease a lot. So you may see some roles here in this time series. They correspond to Saturday and Sundays, okay? And sometimes these registrations done in the weekends accumulate and they are released on Mondays and Tuesdays. And you see these large increases just after a drop. Can you see? This is a weekend effect. And it's possible to correct more or less this using moving average. And this light blue curve you see here is a moving average trying to correct these effects. But when you agglutinate the data in this way, is a problem because the notification date is only an administrative date. It's only when the patient look for attention in a medical facility. Okay, in principle, it has nothing to do with the time scale associated with the disease dynamics. On the other side, the first symptom date is a biological date. It's related, it's extremely related with the dynamics of the disease because it usually starts a few days after the infection. So when we agglutinate the data by first symptoms date, we don't have the perfect representation of the epidemic curve, but we are much more closer because we are constructing this graph here with information that comes from the biology. While in the right side here, we constructed with information that comes from an administrative process, not a biological process, okay? So Rio de Janeiro, fortunately, we have the option to construct this curve here, and we are going to, we use it to fit our models. But in most of the cities of Brazil, the local authorities don't disclose the first symptoms date. They disclose only the notification date. So most of the cities are obliged to use this for the modeling. And you can see that this will impact the predictions. Okay, you see that both curves are different, and this one's closer to the reality than this one. So if you use this one, we must be aware before that our predictions will be biased. But it's better to do predictions and pass some orientation to the public health authorities based on this than based on blinded guesses. Okay. I wish to compare this with these two pictures from Van Gogh. Okay. Suppose this is the reality. Okay. And this is the data we know about the reality. It's our observations here is a distorted picture of the reality. Okay, despite in some cases we may see part of the reality, in others the level of noise is so high that we are almost all completely blinded. Okay, we may have a guess that there is a window here, but we're not sure. While here we see that there is a castle here. Okay. So as the data quality varies a lot, depending on the location, the period in time, okay, we need to process the data in order to be able to use this data for predictions, okay? And data processing here is essential. What kind of processing is necessary? Filter the noise, okay? And sometimes organize properly the data helps a lot to elucidate some issues. I will talk more about this. So now I will pass to the second part of the presentation, okay? I will present to you some classes of mathematical models that can be used to deal with epidemics, okay? You don't have a universal model that's capable to do predictions in all the kind of possible epidemic scenarios you want, okay? You have a plethora of models, and you needed to use the most suitable one for your goals. You needed to know previously what is your goal and choose the suitable model for that kind of application, okay? I will talk about statistical models, agent-based models, compartmental models, multi-scale models, and graphic models, okay? And I will start with the statistical models, which in a nutshell is you have data, you're going to fit a curve to this data and use this curve to extrapolate the behavior of this data ahead in time, okay? And you see here two possible approaches to doing this, okay? This is the model that our group, COVID-19 Rio de Janeiro, does. And you have the statistical model that our colleagues from COVID-19 Analytics use, okay? Both are able to predict reasonable well the they are able to extrapolate well the behavior, but just in short time, okay? They are calibrated with the past, and you extrapolate the future with this kind of model. This one is a very simple one. This is a straight line, and sometimes you use a logistic curve. Marcelo's group use a more sophisticated regressor, okay? And so they can extrapolate better a few days ahead in time than us. But the main lesson here, both approach or any other statistical approach, the predictability range is finite and short, very short, okay? With this kind of model, we can predict well 3-4 days ahead in time. With this one, they can predict 1 week, 10 days. Using a logistic regression, we can predict 1 week, maybe 2, okay? But definitely, we can't predict 1 month ahead, 2 months ahead, 1 year ahead. And in the beginning of the pandemic, unfortunately, we could see some people disclosing completely wrong information. They were using these kind of models to try to predict 3 months ahead, 1 year ahead, okay? By the nonlinear nature of the epidemics, it's impossible. Epidemic dynamics, you don't have predictability so far ahead in time like this, okay? In some sense, it remembers a lot the weather prediction. You can't predict the weather next year. We can't predict today the weather next year, okay? Our horizon of predictability is 1 week ahead, 10 days ahead. Not the mechanism which causes loss of predictability here is not chaos like is in weather, but remembers a lot the mechanism of predictability degradation that you have in chaotic systems, okay? It is related with the human behavior in this case, okay? I will talk more about this a few slides ahead. Those models are good to obtain these numbers here, and these numbers, number of deaths that are expected, number of new cases that are expected, are very useful to give some clues to the hospitals what they should expect in the next days. But if we want to understand the more qualitative nature of the pandemic, of an epidemic, those models are completely meaningless. They don't have a causality effect mechanism embedded on them, so they don't capture the sense of the biological dynamics there. Suppose we wanted to understand the effect of people interact with each other, what this effect may have on the contagion dynamics. I'm showing here agent-based model where people are modeled by particles which move and interact themselves, and you may see here the evolution of the epidemics in this group here, okay? You may think that these are people inside the neighborhood of a city, and they are moving for many different causes. They are going to work, they're going to the supermarket, they are going to school, they're going to the gym, and they are interacting. What's the interaction in this model? When the particles approach each other, you have a certain probability of transmitting the disease here, okay? So in these discrete events that are the encounter of people here, some people, some health people are infected by are infected with the disease by the people which were in the phase which are with the disease active, okay? We represent the health state of the agents here by a color. In blue are health people. In red, infected people. When a blue person here interacts with a red person, there is a probability of transmission. Some people will be infected, others not. And after a certain period, the infection is over and the person is recovered. And we represent recovered here by the pink color, okay? We see that the movement of the agents here age acts in favor of transmission of the disease. How can I affirm this? Let's see what happened if I block the movement of most of the population. Okay, you see that the transmission here is much slower than in the previous case. Here, only 25% of the agents are allowed to move. The other 75 are blocked. Okay, and you see a tremendous difference in the dynamics of contagion. Can you see? Let's compare the height of the infections in this first case. Here, almost all the population is infected after some time. While here, when the movement is reduced, you see that the number of infected people decreases a lot. In the beginning of the pandemic, the experts in epidemics recommended isolation and remove and reduce the movement, the social interactions, in order to slow down the curve. What this kind of analysis is done based on accumulated knowledge in the epidemic literature, but part of this knowledge was accumulated because of qualitative analysis like this one done with agent-based models like this one. Okay, you're not doing a quantitative analysis here, is doing a qualitative one, but this qualitative information that we are obtaining here is extremely valuable. Okay, I wish to emphasize here that most of the time, what we can do and what we should do with these models is to do qualitative analysis. In my experience, qualitative analysis in epidemics most of the time are much more useful than quantitative one. Can you use this kind of model for quantitative analysis? Yes, it's difficult, but we can. But needs a proper calibration. We need to calibrate this with a pattern of movement that's representative of the movement of a real population. Okay, we need to fit the geometry to represent a real place. Okay, it's difficult, but can be done. What I wish to talk now is another kind of class of models that are known the compartmental models. And these models here come from this kind of model. When you pass the thermodynamic limit and you do some kind of averaging in a model like this, in a stochastic model based on agents, on discrete events with discrete agents interacting, you may obtain a continuous model for the mean field that is described by differential equations, okay? And those are the compartmental models. And I wish to talk about especially this class of compartmental models, the SIR, okay? The SIR idea is to split the population in groups, susceptible, infected, and removed, take into account those which are recovered from the disease and those who passed away from the disease, okay? And you deduce a differential equation for each group, okay? And you have some kind of, you have fluxes from compartments. You have flux of people susceptible to the infected compartment, people susceptible become infected and then recover or passed away by the disease, okay? In the last year, we saw a proliferation of these kind of models. People using creativity and necessity elaborated many different kind of models like this. And I show here a possible variation of this model. We may include a confined compartment to quantify people which are confined to protect themselves from the epidemic. We may introduce exposed compartment and symptomatic and asymptomatic compartments, quarantine, hospitalizations, ICU, intense care unit, removed deaths, okay? So how do we deduce equations for this? We do, in some sense, a population balance, okay? The derivative of S is the rate of change of this population. It's caused by the flux of people from this compartment to this, so it's negative. And the flux of people from this compartment to this is proportional to the actual size of the susceptible population and the infected. An infected interact with a susceptible, and this interaction here is represented by the product between I and S, okay? And you have some constant of proportionality. In I compartment, the population balance is the number of people which enter minus the number of population which leaves. And what enters here is the same that left here. So this term here is equal to this one, except for the minus sign. And the number of population which leaves the infected compartment is proportional to its actual size. So you have this, and the number of people entering the removed is exactly what left the infected one, okay? And you have this model here. If you supplement these equations with initial conditions, you can integrate this model and see the dynamic behavior. Typically, you have this behavior here. In blue, the susceptible, in red, the infected, in green, the removed, the recovered, okay? You see that in the beginning, you have a lot of susceptible people, and the number of susceptible decreases, while the number of infected increases. And you have a certain threshold here that after a certain threshold, the number of infected started to decrease until the exhaustion of the disease. While the number of susceptible is decreasing, the number of recovered is increasing, okay? This system here, if you put these equations in a dimensionless form, the dimensionless group which will appear is called the R0, the basic reproduction number, okay? I wish to show you here now the behavior of this dynamical system in function as we vary the R0, okay? Here the R0 is 5, 2.5, 2. What we can see as we decrease the R0, we see that the number of susceptible, which was dropping from the entire population up to almost 0, now is not decreasing up to 0. You have a residual of susceptible people here. Consequently, not all the population was infected, so you don't have the full population recovered. You have a few people which is still susceptible here in the end. Another consequence is a decrease in the peak of the epidemics, okay? You see that the peak here is delayed in time. The peak was moved to the right in time, and the peak height decreased a lot, okay? How do we decrease the R0? We may decrease beta or increase gamma. I will remember you that beta is the rate of transmission. How can we decrease the rate of transmission? If it is a respiratory disease, we may use masks. I don't have a mask here to show, but if we use a mask, I have. Using a mask like this, we're blocking the droplets transmission. So in consequence, the infection events, they still occur, but they reduce a lot in number. So we may slow down and decrease the curve. Another option is this, increase gamma. Gamma is the rate of recovery. How can we increase the rate of recovery? We may increase the medical treatment. Suppose in the beginning, the disease is unknown, the medicine is less effective in treating the people. But after some time, the medical knowledge increases and better treatment, better medicine appear, okay? And people are treated better, and in consequence, they stay infected less time and they infect less people, okay? So you have two mechanisms to act here: improve the medical treatment or decrease the infection transmission. This mechanism, which these analyses I just showed you, parameterized by the R0, is what in the beginning of the pandemic was known as flatten the curve. Okay, let's flatten the curve in order to avoid collapse in the health system, because with high transmission, we may have the curve in the peak bigger than the capacity of the health system. Okay, so the flatten the curve was not a recommendation, a blinded recommendation. People which were talking about this know what they're talking about. They're using models in a qualitative way. This is a qualitative analysis, but give you a priceless information, okay? Compartmental models can be used for quantitative analysis, of course, but they need a proper calibration. We needed to calibrate with data, this model. We need to obtain beta and gamma with data. And more difficultly, we need to obtain the initial conditions for data. And sometimes we don't have even the initial infected population, we don't know with high accuracy. This initial susceptible one is information that is impossible to obtain exactly. We need to estimate. And so we are putting hypotheses in the estimation of the initial conditions. So this is one information, this is one of the mechanisms which cause loss of predictability here, okay? Depending on the initial conditions, the final state of the system may be very different. And if you have a high uncertainty in the initial conditions, this will propagate to the final response so that we have a lot of uncertainty in the final response, okay? I wish to emphasize another kind of qualitative analysis that can be done with this model, okay? I'm adding here another compartment, the confined one. This will introduce a new equation in this system and two new time scales. We have a characteristic time representing the confination rate, the rate where people leave the susceptible and enter the confined, people stay at home. And as they are at home, they're protected from the infection because they are not interacting with other people. But we also have a characteristic time representing the leave of confinement. People became bored. After some time, they needed to leave to work. They needed to leave to go to the supermarket and so on. And so when they leave the confinement, they became susceptible again. I'm simulating here first these dynamics with the confinement turned off, okay? We turn off, we don't have confinement. In this case, we have a SIR dynamics. The dynamics here is equal to the previous one showed to you. But let's turn it on the confinement, okay? I will turn it on the confinement after 30 days of epidemics. What happens when I turn it on the confinement? The confinement is represented here by this gray strip here, okay? And I will keep the confinement for 90 days, 3 months. Observe the peak. What happens when I confine the people? The peak of the epidemic decreased a lot. It was not so delayed in this case, but the intensity reduced a lot. Just after we turn it on the confinement, the number of confined people increases exponentially fast and keeps more or less constant during the confinement. You see that even during the confinement, some people leave the confinement. Those which can't stay for psychological reasons at home, they started to leave for some reason, okay? As the confinement is turned on, the number of susceptible decreases drastically too, okay? It decreases because people are staying at home, not because people are being infected. Some people is because are infected, but this decrease here is majorly by the confinement. And the number of susceptible stay more or less constant during the confinement. Here we have the number of recovered, which after some time of confinement stabilize. But here, after 3 months, we are obliged to turn it off, the confinement. People health, mental health can't support this, the economic can't support this. Plenty of reasons oblige us to turn it off, the confinement. And what happens after we turn it off, the confinement? The number of confined people started to decrease. It decreases slowly because some people keep confined because they are afraid. But just after we turn it off and the number of confined slowed down, started to decrease, the number of susceptible started to increase. What happens with the increase of susceptible? The number of infections started to increase again, and you have another peak. This is what we call second wave, okay? And in the beginning of pandemic, some experts will say, we are going to have second waves after the confinement. And some skeptic people say, no, we are not going to have a second wave. And why those people are so confident? Because they know how to do this kind of analysis. A model, a mathematical model tell you this, okay? The second week, what is the qualitative information we extract here? Second wave. We know that a second wave will happen. And more, we have, this is a mechanicist model. I appreciate a lot compartmental models because of the mechanicist nature. This gives us more information that a second wave will happen. It tells us what's the mechanism behind of this. What's the mechanism behind of this? The increase of the number of susceptible after the end of the confinement, okay? And as a second wave emerged, the number of recovered people increased again, okay? Compartmental models like those I showed to you, they are temporal models, okay? They don't have space dependence, but sometimes may be useful to do spatial analysis. And how can we do this? Instead of using ordinary differential equations, we may use partial differential equations. And this is the work done by my friends Malu Grave, Álvaro Coutinho, and some collaborators. Okay, they're from Federal University of Rio de Janeiro. They adapted SIRD, susceptible, exposed, infectious, recovered, death model. They include space dependence with add of diffusion operators. So this is a kind of diffusion reaction system. And they use this to model the spread of COVID-19 in Rio de Janeiro state where we live, okay? And you can see here the spread, okay? If we are interested in space dependence, these models based on those partial differential equations should be very useful. But it's difficult to use this. We need a accurate representation of the boundary condition. As you may see here, the geometry is complex. The boundary condition is so difficult. And we may also have influence of other states. We may have flux of people here, okay? So boundary conditions in this kind of model is a major challenge, okay? But if you're, while this kind of approach may be useful for a moderate size region, for a country size, like a big country geometry like Brazil, it's almost impossible to use this kind of approach. What is useful to do space temporal analysis in this kind of model is an approach called the meta-population model, okay? That is a multi-scale model. This meta-population combines a model based on differential equations for a city level with a graph structure to take into account the flux of infected people across the cities, okay? This meta-population model here was developed by my friend, Professor Silvio Ferreira, and his group in Federal University of Viçosa. And is one of the best works I saw last year done in modeling COVID-19, okay? They published a preprint of this in April of that year, showing this kind of evolution here, and not in the quantitative sense, okay? These predictions, not quantitative, it's qualitative. In qualitative sense, what they showed in April is what we observed in Brazil last year, okay? The epidemics start in some spots, cities which receive a lot of tourists, okay? The capitals, Amazonas due to the commercial area, and then this started to spread to the countryside as a wave, okay? And this wave covered almost all the country in our horizon of 3 months, and then it started to slow down, okay? And then other secondary waves emerged, okay? So this meta-population model is invaluable to deal with situations where you have a complex flux of people due to highways, airplane networks, and so on, okay? When we are interested in take into account spatial temporal dynamics, meta-population models are a powerful tool, okay? And finally, the last class of models I wish to talk to you is something that some colleagues say that's not a model, okay? Is the graphical analysis of time series. But if you remember at the beginning of this talk, I defined a model as a machine, a box which enter information and get out a prediction. In this sense, I will consider the visual analysis of time series a model, because you have a certain information entering here, the number of cases, the number of deaths, and you're extracting predictions of the pattern by visual inspection. Okay, so to generate this, we put information and we get out of this image. In this sense, it's a model. It's very common. We see this kind of curve for the new cases and new deaths. We see in Google, we see in the news. But this kind of graph, which put the number of new events as function of time, definitely is not the most informative one to see the pattern, the tendency of the epidemics, okay? An alternative approach that I can use is this one. I can put the number of new cases as function of the number of total cases. Here I'm showing the number of new cases every week as function of the total cases record, okay? In log scale. We know that in the beginning of the pandemic or of epidemics, we have exponential growth. When we put an exponential curve in log, it is transformed in a straight line. So while we see this plot here as a straight line, we are still in the exponential phase. And when we leave the exponential phase, the number of cases are not increasing anymore proportionally to the number of actual cases. So the number of new cases per week decreases drastically. When this number started to decrease and we are dividing it by the total of cases, that is a big number. When you leave the exponential phase, you see this rapid dropout here, okay? You see this drastically drop. And this is a signature that we're leaving the exponential phase. So we may have quantitative and qualitative analysis that are very informative with this kind of plot. New cases as function of total cases, new deaths as function of total deaths. And even when we have multiple waves, if we have multiple waves, after some time we may see a new increase here and this way and like this way, okay? What we can we see the time here? Yes, the time is implicit here. The time corresponds to the length of this curve, okay? We see that the curves here have different lengths. This is because the epidemics started in different moments in these countries here, okay? We can do this not only for countries, we do this here in our group for cities in our state, okay? We can compare different geographic locations with this kind of graph. And this is the reason I wish to present you as a model, because it gives you valuable information, okay? And another way to represent these dynamics graphically, especially for the public, for non-experts, is using these heat maps I'm showing here, okay? These heat maps were colored according to the number of cases, okay? More directed to red color, more intense is the infection here, okay? We have the number of new cases here as function of time. And we see that we have a peak here, then started to decrease and then slow down. This is the heat map for Brazil. Each line here represents a Brazilian state, okay? And we call this graph for the general public the thermometer of COVID, okay? Because it's showing the temperature of the epidemics. For the general public, this kind of graph is very instructive, okay? Some people without training math may have difficulty to read this graph, but I believe the thermometer, everybody knows how to read and see, oh, we're better now, oh no, we're in terrible moment now. Look at the time series. Here's the number of total deaths for the Brazilian states, and this black curve is for the Brazil, okay? As function of time, here we have for the first 450 days of epidemics. We see that the scale of the epidemics is very different in the states. And the reason for that is the size of the population. São Paulo is the biggest state, so it's expected to have more cases there, okay, more deaths there, because the population is much bigger, okay? Sergipe is a small state. But we see some kind of universal pattern here. All the curves have the same shape. What is different is the rate it achieves, the level where each achieves a steady state is different, okay? Is there a way that we can remove the influence of the population size in order to have an idea of what state was most affected? Yes. If we normalize this by the population size, we have this. Here we have a variation between 1,000 up to 100,000, hundreds of thousands. This is in log scale, okay? When we normalize by population, we see that all the states, the steady state level is around 1,000 per 1 million of inhabitants, okay? We have some kind of universal scaling law here, okay? More or less, the epidemics follow the same mechanism in all the places, at least in Brazil, okay? And we have an average of the country here, okay? So this is an interesting analysis to do here, extract some pattern, and we may see which states are following more or less the normal pattern, and you see some states that which deviates. And interesting questions arrive here. Why these states are deviating? And I sadly, the deviation in Amazonas here is because in January of this year, we have a collapse in the health system, okay? So the number of deaths became discrepant from the expected pattern because of the collapse in the health system, okay? Some people died by lack of medical attention, fortunately. The last thing I wish to show you is an analysis using logistic regressors, okay? We are doing curve fitting with this kind of function here. This is the classical logistic curve, which has this behavior. You see that this resembles a lot a logistic curve, okay? So we're using this kind of model to fit this kind of data, okay? In epidemiology, this curve here is called the prevalence, okay? And its rate of change, its derivative is called the incidence. The incidence is that curve of new cases, and the prevalence is the curve of total cases, okay? As many people here are not from biology, but from engineering, math, and other sciences, I like to do an analogy with the kinematics. This is the displacement, this is the velocity. So if this incidence curve is the velocity, its derivative is the acceleration. The incidence rate of change is this one. And it's a curve which can give you a qualitative view of the epidemics. How? If we color this according to the acceleration, look, in the beginning, we have an accelerated phase, which then started to slow down. It's still increasing, but in a slower rhythm, okay? So the total number of cases increases very fast in the beginning, then it keeps increasing fast, but in a slower rate. Then it started to slow down, up to a certain point. Then they slow down, decreases up to achieve a zero rhythm. And so this is a steady state. Okay. The acceleration, the 4 phases of the acceleration allow us to analyze the incidence and the prevalence curve in a way to know that if the epidemic is warming, if it is speeding up or slowing down, okay? And I wish to do this with the curve of Brazil. Look, this is the curve of Brazil between January and May of 2021, okay? We are fitting this curve here using the last 2 weeks of data and using it to predict 2 weeks ahead, okay? And this is the total number of cases. Can you see here the color of the Brazilian curve, the total number of deaths? It's speed up in the beginning, then it keeps speeding, but in a slower rate. It's starting to slowing down. It's slowing down a lot up to November. In November, it started to increase again. The second wave started, okay? And you see it is slowing down. And then we didn't see the second wave slow down here. It speed up again, then slow down, okay? Here's the total of deaths. This is the number of deaths per day. Using this color classification scheme, we are able to anticipate the tendency. We can say, oh, in the next week, the most expected outcome is a slowdown in the cases. No, it's a speed up in the cases, okay? What gives us this information? The acceleration of the incidence curve. Displacement, velocity, acceleration, prevalence, incidence, rate of change of the incidence, okay? So I wish to close with some key messages. Epidemic modeling is a multidisciplinary area. You need professionals with strong mathematical training, but you also need people from biology, social sciences, okay? These models are powerful tools to add in the decision making, but they must be used carefully. You need to be very careful in interpreting the results because of the multi-scale nature of the epidemics, because of the poor data that we are using here, okay? And mainly because of the ethical implications of the decisions here. You're dealing with people's life, so we can't take a decision blinded, only take into account the outcome of a model without discussing the ethical implications, okay? So this is the main message I wish to talk to you. If you are doing modeling on this scenario, talk with people of other areas, discuss the implications of the decisions that you wish to suggest based on the outcomes of the models, and stay very confident that these outcomes make sense, okay? If you are interested in starting in this area, our group developed an educational code called Epidemic, Epidemiology Educational Code, what you can download in this address here. You have MATLAB Octave codes, and you have a tutorial, a pedagogical tutorial, so you can reproduce these results I showed here with this code. You can play with it a lot, okay? I strongly encourage you to use this code. And finally, I wish to acknowledge for the invitation for this talk. It was a great pleasure to talk to you about our work in this area. I wish also to acknowledge our collaborators from other groups that monitor COVID in Brazil and the financial support of these founding agencies to our group. Thank you very much for your attention. If you have any questions, I'll be very happy to answer.
Thank you very much, Dr. Americo, for such an informative talk. Now, the webinar is open for discussion. If any participant has any questions, you can ask.
Yeah, I have a question. Yeah, this was a nice talk.
Pradeep?
Yeah, can you hear me?
Yeah, I can hear you.
Yeah. So you described about two differential equation, ODE models, SIR and SIRC. Like, how did you select this initial conditions, and like how important this initial condition will be for these models?
The use of one of the main challenges in using these compartmental models based on ODEs is to properly choose the initial conditions. Okay, if you try to infer this from data, you may use some kind of data simulation procedure. You may, but perhaps the initial condition you're going to obtain is a poor approximation for reality. So in order to take into account the possible variability, what is common here is to do an ensemble of predictions. You randomize the initial conditions and you simulate for different kinds of possibilities of initial scenarios and see how to this propagate, okay, for the future. Other kind of, when you're trying to do only qualitative analysis, not quantitatives, what you can do is, in this simulation here, I set it up the number of infected equal to 1. I have 1 infected individual, none recovered yet, and the entire population minus 1 susceptible. So we may see the effect of the spread of the disease in the entire population. We can also do we can draw other scenarios. Suppose half of the population susceptible, and you have 1% of the population infected. For qualitative analysis, you may arbitrate and see how is the outcome. For quantitative analysis, you should use data simulation, but you need to supplement this analysis using some kind of uncertainty propagation, to see the uncertainty in the initial conditions, how they propagate to the prediction in the future. Okay, you need to do what the meteorologists call ensemble predictions, simulate the dynamics for an ensemble of sets of possible initial conditions.
Yeah, next model, like going on to this, like you selected spatio-temporal model. Now it becomes more complicated. Like if I think like so we have to bring in that initial condition along with that. Like how do you define that boundaries? Like that will be very complicated. Like
the boundary here is the geographic boundary of the state, so it's very complex, as you can imagine, because it's defined by the geometry of mountains and so on. We may have two types of boundary conditions here. So we may have the prescribed value of a function, which is easier to deal, but we may have fluxes. Fluxes are difficult to set up here. What are the fluxes here? People entering by car, buses, okay? So you may contrast this geometry with the road map of the state and see where you have main fluxes of cars, okay, coming from the other states. In this region here, in this north part, Rio de Janeiro, the boundary is with Espírito Santo state. Here is with Minas Gerais state, and here is with São Paulo state. So we have fluxes with 3 different states. To impose these fluxes, one possibility is to see the road map, the highways which connect the states, and see the flux of cars, the average flux of cars in a day there, and put this there is one possibility for the flux. And for the prescribed number of cases in the borders, you may use the epidemic, the surveillance data. Okay, you may use the surveillance data, but this is an approximation. You don't take care. You don't register all the cases that happen. You essentially registered the cases that go to the health system, okay? So the under notification is massive here, okay? So in all kind of epidemic analysis, you need to be aware that you're doing calculations that are for the number of cases, and the number of cases is not the number of real cases. The number of registered cases is massively under-notified.
Yeah, thank you.
I have one question. I have one question related to the to the equations, because you have obviously some deterministic system, and I'm thinking that maybe if initial conditions are so important, maybe we should also include some disturbances which could appear during the time. So there could be some stochastic components, yeah, in the system, yeah.
A very nice observation, Jagos. I didn't mention here, but another possible approach using differential equations uses stochastic differential equations, where you may have the initial conditions random, but stochastic differential equations usually are used here when you want to randomize the transmission process. So you transform this beta is over n term here into a Poisson process, for instance. You may use this. But when you want to take into account the uncertainty in the initial conditions, usually the most used approach is to attribute a probability distribution to initial conditions, draw values for these initial conditions according to these distributions, and simulate them. Okay, a Monte Carlo simulation with the random initial conditions. This is very common here. May I show the work of one of my students? He just finished the master. He did this. This is the kind of curve you obtain when you do these Monte Carlo simulations with random parameters, for instance, the random initial conditions. You see that the envelope for the future is very broad. So sometimes, okay, you're covering all the possibilities here, but I must admit sometimes it's not a lot informative. You may have between 100,000 up to 500,000. It's very, very broad. Okay, how to decrease this? If you better characterize the uncertainty, you may close a little bit this envelope, but this is intrinsic to the epidemic phenomena. The epidemic phenomena is uncertain and exponentially growing. The uncertainty exponentiates too. So this is a tremendous limitation associated to the nature of the phenomena. Did I answer your question, Jagos?
Yes, thank you very much. Yeah.
Dr. Americo?
Yeah.
So one of the questions that was asked by the participant in chat box. So are there any references for this kind of work that you have explained here?
You wish a pedagogical reference? There are many useful books. One I like a lot is this one. Fred Brouwer books, Mathematical Models in Epidemiology. This is a nice book Okay. You have a lot of review articles emerging in the literature in the recent months because epidemic modeling became so popular in the last year. Even myself, I'm writing one, and perhaps in a few months you're going to have a preprint. So, but a basic reference to start, I recommended this book here, Fred Brouwer, Mathematical Models in Epidemiology by Springer.
Okay, thank you. So one more participant has asked the question, any best research journals in this field to publish an article? Can you suggest some of the journals where they can publish their work?
Depends on the goals. If your goal is to develop a new mathematical tool, you have the mathematical-oriented journals. You have Journal of Mathematical Biology, Nonlinear Dynamics, which is journal which is a key journal for the community of nonlinear dynamics and engineering, is publishing some interesting articles regarding the modeling. But if your goal is to discuss the biological aspects, you need to go more to the biomedical literature, which I'm not an expert. I work with this previously from COVID. I've been working with epidemic modeling since 2016, first with Zika virus and then with COVID. But I'm publishing in these mathematical-oriented journals. One interesting journal I can suggest, which is an intermediate between math and biology, is called Epidemics. Is this journal here? Epidemics. It's edited by Elsevier. It's a journal of modeling on epidemics, okay? But the typical article here, you have a modeling work, but you have a deep discussion on the biological aspects, on the implications, okay? So it's more or less a middle term between more math, more biology. I think this is the border between those works. At least this is the journal I know which lives more or less in the border, okay? But you have journals on epidemiology, Lancet, the Lancet infectious diseases. Lancet is more inclined to the biomedical, okay? You have this one more inclined to the math, okay? But you can publish math-oriented papers on this in several different journals of applied math, applied mathematical modeling, applied mathematics and computation, nonlinear dynamics, okay? It depends on what are the goals of the article and what is your contribution. I think you should decide the journal depending on the contribution of your research in this field, okay? Methodologies, maybe this is a good journal for the others.
Am I audible? Good evening, all.
Yeah.
Yeah, I just wanted to have some discussion on the spatio-temporal equations, what you have shown on one of the slides.
The spatio-temporal, yeah.
Yeah. Can you go to that slide?
Could you repeat the connection is unstable? I could not understand the question.
Yeah, can you go to that slide? Spatio-temporal equations you've shown in one of the slides.
This one?
Yeah, this one. As already discussed, Professor Manji, obviously when it comes to boundary condition, the solution of the equation becomes very much complex in nature. Adding to that, I just wanted to know the diffusivity constants, how we are able to choose the diffusivity constants, diffusion constant.
The diffusion constant is obtained by solving an inverse problem. You have the initial state. Okay, you have the initial pattern of the spread here in the state. You can calibrate the model, solve an inverse problem. You construct a function which mensurates the distance between the observations and the predictions. Of course, first you are going to arbitrate a value for the diffusion, and you're going to predict with this and compare the discrepancy between these predictions with arbitrated parameters and the observations. And then you solve an optimization problem to minimize this discrepancy. Okay? You're going to solve an inverse problem. You are going to minimize a cost function, which is defined with add of the differential equation.
Okay, fine. So it is sort of like a mismatch, not mismatch, like a minimization problem. Based on that, we are finalizing the diffusivity constant.
Yeah.
Yeah. Thank
you. I should call your attention. This is an inverse problem involving a partial differential equation. This is extremely complex and expensive.
Yes, yes,
okay?
yes. That's what.
Much more difficult to calibrate this model than solve this model for analysis. Okay.
Yeah. Thank you very much.
You're welcome.
Dr. Americo, I have a question.
Yeah.
So now at present, in almost all the countries, vaccination is going on. So how can this, the effect of vaccination can be implemented in this modeling, mathematical modeling?
May I show you a previous talk? Can you see here? This is a model for Zika virus spread. Susceptible, exposed, infectious, recovered. And you have a second population of mosquitoes, which the mosquitoes are the vectors of the disease. If we wish to include vaccination, we could include an additional compartment which take into account the vaccinated people. Susceptible people is vaccinated. And vaccinated people, part of them can become infected, but this infection here is much smaller. You see, susceptible people is exposed to the disease. Vaccinated people may be exposed to the disease. But you have a factor sigma here, which decreases a lot the probability of infection in vaccinated people, okay? So you may include an additional compartment and another parameter that take into account the protection factor of the vaccines.
Okay. Thank you, Dr. Americo.
Other questions?
So any questions from the participant side?
This may add an additional information. This group here from Professor Silva Ferreira which developed this metapopulation model, they are now working with vaccination models. They were doing vaccination is well developed now in Brazil, but in the beginning they were studying optimal strategies to vaccinate using models.
So I hope there are no questions from the audience side. So now I request Dr. Yamwai Dange to propose a vote of thanks for this particular webinar. Okay.
Good evening to all. Honorable Speaker, Dr. Americo from Brazil, respected dignitaries, and all the delegates. On the behalf of R&D Cell, Department of Mathematics and Chemistry, BLDE's College of Engineering Technology, and Committee for Promotion of Science and Research, BLDE Association, Vijayapur, I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Chief Guest and Resource Person, Dr. Americo, to take out time from his busy schedule to grace the event. We are really enlightened with your knowledge and presence. We are also thankful to our Honorable President of BLDE Association, Dr. M.B. Patil sir, Dr. R.V. Kulkarni sir, Administrative Officer, and Dr. Kushal Das sir for their motivations. I would like to thank our beloved principal, Dr. Atul IRA, Vice Principal, Dr. Pradeep Malji, Dr. G.V. Patil for their support. At the end, a special thank to our organizing committee and teaching and non-teaching staff for their support and coordination. Thank you, one and all.